So welcome to our November Teach Educational Rounds. Here with us today, we have Dr. Osnat Melamed, who will be presenting on women-specific smoking cessation support. So I'll start us off with KMH's land acknowledgement. KMH is situated on lands that have been occupied by First Nations for millennia, lands rich in civilizations with knowledge of medicine, architecture, technology, and extensive trade routes throughout the Americas. In 1860, the site of KMH appeared in the Colonial Records Office of the British Crown as the council grounds of the Mississaugas of the New Credit, as they were known at the time. Today, Toronto is covered by the Toronto Purchase Treaty No. 13 of 1805 with the Mississaugas of the Credit. Toronto is now home to a vast diversity of First Nations, Inuit, and Métis who enrich this city. KMH is committed to reconciliation. We are honor the land through programs and places that reflect and respect its heritage. We will embrace the healing traditions of the ancestors and weave them into our caring practices. We'll create new relationships and partnerships with First Nations, Inuit, and Métis, and share the land and protect it for future generations. Now, I invite everyone to introduce themselves in the chat and let us know which traditional territory you are joining us from today. If you're not sure, you can visit that website there. I can try and pop the link in the chat in a second. You're also welcome to let us know something that you're doing to learn or improve your commitment to reconciliation. Now, while I give everyone a chance to do so, I'll just share a bit about myself for those that are joining for the first time. My name is Natalie, and like KMH, I am currently located on the lands of the Mississaugas of the Credit. I live in Toronto, and as a white settler myself, I acknowledge the privilege I have to live here and feel safe. So I myself am committed to reconciliation. I continue to listen and uplift the voices of various Indigenous communities. So I'll give everyone a few seconds to share. I'll also put that link in the chat in a moment. There we are. Welcome, everyone. Thanks for sharing. In the meantime, please do keep sharing in the chat. We'd love to hear your comments and reflections. I'll just continue on with a few housekeeping items for now. So if you're interested in receiving a letter of completion for this Teach Educational Rounds, please make sure you've registered for the webinar and completed the pre-learning assessment. As well, make sure you signed in to the webinar using your full first name and last name so we can track your participation. And last but not least, complete the evaluation and post-learning assessment that will be emailed to you by tomorrow, and you'll have 1 week to complete that. Along with that, those that registered will receive a copy of the slides as well as the recording to review or share with any colleagues. So here's a bit more information on our presenter today. Dr. Osnat Melamed is a clinician scientist in the Campbell Family Mental Health Research Institute and a staff addiction physician here at KMH. She's also an assistant professor in the Department of Family and Community Medicine at U of T, where she holds the 2023 New Investigator Award. Dr. Melamed is an early career investigator with research interests in tobacco addiction and the intersections between substance use, mental health, and gender. Dr. Melamed is interested in the use of technology for the delivery of treatment for substance addiction. She develops innovative digital health tools such as smartphone apps and AI-based chatbots to support individuals in quitting smoking. And so just a couple of disclosures for her to report. Give you a second to read those. And please note that the content of Teach Educational Rounds is centered on evidence-based guidelines from the following sources. Nonetheless, these materials, as well as the verbal presentation and any discussion, represent only general principles, and they do not remove the need for clinical assessments or treatment plans by healthcare providers. So please feel welcome to use the chat feature throughout the webinar to post any comments. For our presenter, we will ask that you hold off on any questions until the end, when we'll have a bit of a question and answer period. But if you have any comments throughout, you can click on the speech bubble icon in the control panel to share those. Just ensure you select everyone so that all panelists, hosts, and attendees can read and respond to your comment. You're also very welcome to use the reaction feature to share a thumbs up or a smiley face throughout the webinar. So with that, I will hand it off to Dr. Melamed to take it away. Thank you, everyone, and enjoy the webinar.
Thanks very much, Natalie. Can you hear me okay? Yeah, okay, perfect. So hello, everyone. Good afternoon. Thank you for joining this session of Teach Educational Rounds. And the topic for today will be women-specific smoking cessation support. So, I think myself, very similar to many of you, work in smoking cessation counseling and support. I work at the Nicotine Dependence Clinic here at CAMH, and I see both men and women for smoking cessation support. And I think what's very obvious is that when folks come to us, we don't have different suggestions or different recommendations based on their sex or gender. That means that we offer the same medications, whether it's a man or a woman standing in front of us. And we offer the same behavioral strategies, again, very similar for men and women. And one of the things that we'll talk about today is that sex and gender actually play a significant role in differences between men and women, both in motives for smoking and also barriers to quitting. So understanding those can help us develop tailored treatment for smoking cessation for women. And then today we'll talk about how we took some of this, gender-specific content and integrated into a smartphone app that's meant to help women in their quit smoking process. And last but not least, we'll share some information on our upcoming study that aims to test a smoking cessation app for women and to see what women think about it. Could it be helpful for their needs? One thing that you can see here in my slide on the right is an advertisement from Australia. And this one is targeted specifically for women stop smoking, start repairing. And you see a woman here in the middle. And if you look at those bullet points that are out there, most of them talk about the health effects of smoking. And we know when we quit, we get benefits for health. We all know that. But interestingly, two of those bullet points actually point to sex and gender specific reasons that women would want to quit smoking. So one of them is the reproductive health on the lower right-hand side, telling women that if they quit smoking, they have better chances of having a healthy pregnancy compared to women who continue to smoke in pregnancy. And we do know that women, when they're pregnant, it's a big motivator for them to quit smoking. Same thing with women who have young children, big motivator for them to quit. You can see on the upper hand side another gender specific item that's meant to encourage women to quit. And it talks about the effect of smoking on a woman's appearance. We do know that smoking causes damage to skin, especially facial area. And we know that women are more likely to be concerned about the effects of smoking on their appearance than men. So this is just a few examples of how this has already been incorporated into different messaging that's meant to encourage women to quit smoking. So let's talk a little bit about the prevalence of smoking, among men and women. So we do know that more men smoke than women, and that's pretty much what we see across the board in different countries. Here in Canada, approximately 14% of males and 11% of females among the adult population smoke cigarettes. We also know that smoking has been, that the rates of smoking have been going down probably since the 80s, maybe even late 70s have been going down slowly. And we do know that the rate of decline in the prevalence of smoking is going down faster for men than it is for women. It's also concerning to learn that in medium and low income countries, such as India and other places, they're seeing now an increase in the number of women who are starting to smoke. And in high income countries like Canada, we see that smoking is concentrated among women who experience socioeconomic disadvantage. So in this graph, it talks about the stages of the smoking epidemic. And the line in green represents men, and the line in blue represents women. So what you can see is that the uptake of smoking has been greater among men throughout the years. But as you can see, at some point, this could be, I think, probably around the 80s, you can see that there's been a sharp decline in the number of men that are smoking. If you compare that to the blue graph, which is the women graph, you can see that, less women than men smoke, but we don't see that sharp decline in the number of women smokers, potentially hinting to us that when women pick up smoking or take up smoking, it's harder for them to give it up compared to men. And it's also interesting to see the dotted line, both in green and in blue, which means the number of deaths that are attributed to smoking. So in men, we start to see, there was a big increase that was concordant to the prevalence of smoking, but we start to see that that line is trending down, meaning less men today are dying from smoking compared to 10 or 20 years ago. But the sad thing is that we don't see the same trend in women. In women, we see that there is an increase, and currently there is no decrease in the number of women that die from tobacco-related illnesses, perhaps indicating that it's harder for women once they start smoking, it's harder for them to give up smoking. What are some of the sex differences and the health effects of smoking? So all of us work with people, in our practices to help people quit smoking, and we see a lot of the times people come in after they've had, a diagnosis of cancer, perhaps, lung disease like COPD or a heart attack. And if you look at the statistics that I'm bringing here, it's quite staggering to see that. For example, with lung cancer, we see that women are 64% more likely to have a diagnosis of lung cancer compared to a person who doesn't smoke, whereas in men, they're only 43% more likely to have a diagnosis of lung cancer. And this is comparable, both for a man and a woman with the same smoking intensity. So, for example, both of these would, on average, smoke a pack a day. So women face greater health risks. We see that also in COPD. When women smoke and men smoke who have COPD, we see an expedited reduction in their lung function. In women more than we see that in men. Similarly, we see something, we see this trend in coronary events, in heart attacks. Women, that smoke an equal amount to men are 25% more likely to have an acute coronary event or heart attack. So, this is quite concerning, and we realize that, smoking is bad for everyone, but for women, they seem to face greater health consequences. And one of the questions is, how can we explain this phenomena? Why are women more likely to have heart attacks or lung cancer or, worsening COPD? So one of the main explanations for this are physiological differences in body size and composition. So if you think about it, many women have a smaller body size compared to men, which means, smaller lungs, for example, and if they smoke the same amount, the amount of toxicants that are delivered to a smaller organ potentially are larger and therefore causing greater damage. There is some also thoughts about the composition of the body. Women have a larger body percent of fat, which can sometimes store different toxicants or chemicals, and leading to longer exposure, thus explaining greater degree in lung cancer, for example. So definitely, we want to think about the health effects of smoking in women as a group that potentially has higher risks. What are some of the women-specific motives for smoking or quitting? So interestingly, we know that weight control has been a big motivator for young girls and young adult women to initiate smoking. So if we look into the population, I mean, usually this is done by surveys, about people who picked up smoking in their teen years or early 20s. We see that there are more women who are overweight and obese who are starting to smoke in those years. And the reason that they give us is because they're using cigarettes, or the nicotine in the cigarette provides a stimulant effect and reduces their appetite. So it's a way to, instead of eat, I can smoke a cigarette and kind of skip a meal. That can help me in my dieting efforts. We also know that more women than men cite the stress relief function of a cigarette. They value it more. Women value it more than men. So more women use cigarettes to cope with stress. We also know that women who are pregnant, who are mothers, are more likely to quit smoking. So we see this effect of their gender, the fact that many people could judge or have some unfavorable comments if they see a woman who is pregnant and smoking, or a woman who is smoking next to her young children, and that creates a lot of pressure on a woman more than on a man to quit smoking. We also want to talk about some of the barriers that women tell us that they have in quitting. One of the main reasons that that we hear from women who come to us is that they don't have the social support to quit. So a lot of the times, quitting can be a long process. It takes patience and perseverance, and having someone in your team, someone in your corner that supports you through those rough patches. If you had to slip, or having difficulty meeting your goals, having social support can make a world of a difference. So many women tell us that they're lacking this support, and it's hard for them to do it on their own. We also know that for many women, if their partner, their male partner, is a smoker, it's harder for them to quit. And this is not true the other way around. So if a man has a woman partner who is smoking, they don't struggle as much to quit. And this again is related to gender power imbalance, and making it hard for women to, for example, to communicate or advocate for a smoke-free home. It's more difficult for women than it is for men to do so. We also want to point out, and we've alluded to this already in previous slides, that more women than men smoke cigarettes to deal with unpleasant emotions. This could be, for example, feeling low mood or depressed, sad. We do know that depression is twice as more common, nearly twice as more common in men than it is, in women than it is in men. Therefore, creating another barrier for women to quit. One of the interesting theories that was recently published is called the theory of sociopharmacology. And what this theory claims is that we have social determinants of stress. So different things in our lives can lead to stress. And this could be, for example, experiences of domestic violence, or caregiving burden, poverty. All those add to the stress in our lives. It also says that, because women experience a greater degree or greater number of those social determinants of stress, it creates a condition or a cue, a conditioned cue for smoking. So for example, if I'm a single parent, and I'm, making, it's hard for me to make ends meet, I'm going to be very nervous, towards the end of the month because I don't have enough money. That could sort of, make me to want to reach out to that cigarette to kind of cope with that stress. So we know that more women have more, social determinants of stress relative to men. And this sociopharmacology claims that it's that smoking, therefore, in those moments of stress becomes, a conditioned cue. So if I'm feeling stressed, the first thing that comes to mind is I need a cigarette right now to deal with that stress. What about quit intentions? Do women want to quit to the same extent as men? So we do have evidence to suggest that it is the case that women are as likely as men to attempt to quit smoking. But the sad news is that women have less success on a given quit attempt. And even those who are successful in quitting have a greater difficulty in maintaining the long-term abstinence. They can maybe quit for a week, for a month, but if you go back to them after 3 months or 6 months or a year, they tell us that they've gone back to smoking. So we know that the intentions are there, but the success not as much. And I want to present some of the evidence from our own STOP program. And, I have patients that are part of the STOP program, and I can imagine that many of you on the call today have, lots of patients that they see that are part of the STOP program. So our team of researchers here at the Nicotine Dependence Clinic looked at that information, and what they did is a simple comparison between the quit outcomes that are recorded among the men and among the women in the STOP program. And I think, this was another evidence to show that, yes, women in the STOP program are less likely to succeed compared to men. So they were 60% less likely to succeed. In terms of the quit rates, it was 24% versus 27%. And something to keep in mind that, because we have a very large sample in the STOP program, we could adjust those results, meaning that it's not because women, were heavier smokers. It's not because they had more addiction problems or mental health problems. We could control for all those variables. So just, the only difference between those groups were the fact that the sex, right? Men versus women, or males versus females. And, if you think about it, 24% versus 27% doesn't strike us as a huge difference. But if you think about it, 100 smokers, 27% of them, of the men are able to quit. Whereas in a group of 100 women, only 24 are able to quit. So we have those, perhaps three women that would face, very hard, health, detrimental health consequences because of their smoking. So definitely we see a clinical, not only like this, statistical significance, but we see a clinical significance as well to having less women succeed in their quit attempt. So how do we explain this, this discrepancy in success between men and women? What are some of the factors that sort of weigh into this? One of the things we want to talk about is the effectiveness of smoking cessation medications. So, this study that was published, a couple of years ago, they actually looked into, the effectiveness of smoking cessation medications. Is it similarly effective between men and women, or perhaps there are differences? And interestingly, what they found is that in the group of women, varenicline, that as we all know is Champix, is far more effective than both the patch and bupropion. So you can see that on the right-hand side. You can see this big, long bar of the varenicline effectiveness compared to the other two. And interestingly, for men, we did not see this difference. So for men, slightly better with varenicline, but men are also doing pretty well, almost comparable to varenicline, both with bupropion and the patch. But we don't see that with women, right? So women don't do as well. In fact, we see that there's, a statistical significant difference. When women use the patch or bupropion, they don't succeed as much, whereas if they use varenicline, they succeed more. So, again, what might explain? So we talk perhaps it's the medication that they are choosing to use. We also know that there are sex and gender differences in the quitting experience. So when we ask women about their, about their quit attempt, and we ask also, both men and women tell us that they have more withdrawal symptoms. So the intensity of the withdrawal symptoms is higher. They report a greater number of withdrawal symptoms. And finally, what leads them to go back to smoking is actually this withdrawal, right? That, I want to end this, miserable experience and I want to smoke again just to feel better. And this also explains to us why when women choose to quit cold turkey without any smoking cessation medications, which we know all of them, do something to alleviate or reduce the intensity of withdrawal symptoms. We know that when women quit cold turkey, they actually, are 40% less successful than men. So cold turkey is probably, the best approach for a woman to try and quit smoking. They're not going to be as successful as men, and they're going to struggle with a lot of those withdrawal symptoms. And what are those withdrawal symptoms? Just kind of, bringing, them forward here. So, we hear a lot of women saying, when I try to quit, right? I have very strong cravings. I feel irritable. I feel anxious. I feel depressed. I feel restless, right? Like I can't sleep. And as we mentioned in the slide before, women would have a stronger degree of those withdrawal symptoms, stronger intensity, and also they would have a greater number, right? So I'm having, I'm feeling, very low energy, and I'm feeling anxious, and I'm feeling restless, right? So a lot of those things combined together make it really hard to sustain this quit. Even if I was able to go a day without smoking, it's going to be really hard over the long term to deal with those. Another thing that we want to talk about is sex and gender differences in the quitting experience that are related to the menstrual cycle. So we know that in the earlier phases of the menstrual cycle, days 1 to 14, usually women have a lower degree of withdrawal symptoms compared to what they experience in the later phases of the menstrual cycles, the day 15 to 28. So this could also tell us why some women struggle. It depends on the timing of their quit attempt. And in fact, my colleague from the Nicotine Dependence Clinic in Intrepid Lab, Dr. Laurie Zawarter, is actually conducting a study that will give us the answer. If we ask women to time their quit date to, to the earlier phases of the menstrual cycle, will they be more successful than those who are quitting on the later phases of the menstrual cycle? So we all have to stay tuned for the results of that study. Okay, so we talked about how quitting is influenced by a number of sex and gender related factors, and we have greater understanding of all these factors. So I think it makes sense for us to try and incorporate some of this new knowledge, some of our understanding of how sex and gender influences smoking and cessation. It makes sense that we should incorporate it into smoking cessation interventions, or really tailoring those interventions for women. And as you recall, we started this talk by saying that currently we pretty much have this sort of gender neutral, one size fits all approach. We don't have a separate program for men and women, but it makes sense that if we could incorporate some of these concepts that we talked about, we could help more women potentially quit smoking. This is just a quick summary slide. We talked about both sex and gender influences. So sex would be, different response to medications, hormonal changes such as the menstrual cycle. And gender could be, those social determinants of stress, why women experience more stress, if it's because of, a coexisting mood disorder that's more common in women, or a caregiving burden, financial stress. So we know that both of them exist and both of them are at play in making it harder for women to quit smoking. Okay, so now we get to talk a little bit about digital health tools. One thing that we want to ask is, why do we, want to use digital tools in order to help, women quit? What are some of the, the advantages that they could have? So we have to talk about some of the challenges that women have in accessing care. We know that many women do have competing demands and responsibilities that makes it more difficult for them to access support continuously in the clinic in person. And by using a digital tool such as a smartphone app, we do have a broad reach, overcoming geographical barriers. and really allowing greater access in women's own space and time. Another big advantage of digital tools is they're easily customizable to include content that could be helpful for women. So it doesn't take too much to create to bring in to bringing this content into an app, especially if we have an existing app to begin with that as I'll show in the next couple of slides. Okay, so a little bit about the work that we did to co-create a women-specific smoking cessation app. So what we're doing is building on an existing app. So I think many of you are familiar with the My Change Plan app. It's been developed at a nicotine dependence clinic a couple of years ago in collaboration both with the clients, with clinicians, students, and scientists, and our partners in the electrical and computer engineering department at U of T who have helped develop or code the software for this. Currently, the app is live and free for everyone to use, and it is maintained internally at ChemAge by IMG. One of the things that we want to say about the existing My Change Plan app is that it provides psychoeducation about tobacco dependence, consequences, treatment, behavioral tips. It allows folks to track their smoking, create a change plan, tips on how to deal with cravings, and also sends push notifications to help encourage people to keep their motivation high. Yes, I'll just quickly share a few snapshots of the My Change Plan, so you will get the feel of what it contains. And we are talking about the version that's currently available for everyone to use. It's a version that is gender neutral. It does not provide specific content for women. It's there for everyone to use, both men and women. So we do have in the library of the app, we do provide psychoeducation, or basically, how increasing the health literacy of people around, smoking cessation medications, the support that they should use when they're quitting smoking, if it's through Smokers Helpline or the Canadian Cancer Society. We also want to emphasize that there are different behaviors that go hand in hand with smoking, for example, heavy alcohol drinking. So we do point to that and help people understand whether they're drinking to excess, how that might affect their ability to quit smoking successfully. And of course, just to add more information on healthy nutrition, how to reduce stress and physical activity. This is how the app helps folks develop healthy coping skills. So I think, first of all, it raises the awareness of where do most of my cigarettes come in during the day, both by location, for example, in the car, and also by mood, bored. So if I track my cigarettes and get these results, I do have to come up with some alternatives, because if every day when I finish work, I get in the car and I drive home and I smoke, it's probably good to come up with a strategy to, address this, right? What do I need to do? I need to maybe remove all the ashtrays from my car. Perhaps I need to have, some gum with me, either sugarless or nicotine replacement. And perhaps, keep my hands busy with something like a fidget or something to make sure that I don't go back to, lighting up a cigarette. Same thing with, cigarettes by mood. If I'm, if I usually light up a cigarette when I'm bored, for example, I'm waiting for a transit, or, I'm just home and I have nothing to do. So really identifying, what I can do, what might be a good alternative for lighting up that cigarette. Yeah, we always, work with our patients, help them strategize and elicit some of the things, the alternative things that they could do instead of lighting up a cigarette. The app also helps folks create a change plan. So we talk about, helping people set a goal, whether it's quitting or reducing, what's their target quit date. The app helps them record their motivations for quitting. So, why is this important for me? Is it because, I'm about to be a grandparent? Is it because I want to save money? Is it because, I've recently started coughing and I don't like that? I'm worried about my lung health, right? So different people have different motivations. So we can record that and frequently, look into that. We talk about some of those triggers and also what are their coping strategies. And we also want to make sure that people have a support team. We talked before about, how important it is to have someone in your corner to support you in this, push you through some difficult times if you had a slip or you didn't meet your goals, just encouraging to keep at it. This could be someone from your contacts in your phone, or you can sort of put a picture in. So there are a lot of different options that go in there. Similarly, dealing with cravings, right? What are some of the things that could help me deal with cravings? And the app sends notifications into the phone. So, congratulating me for, having a smoke-free day or encouraging me not to give up. So in our program of research, what we did is take this My Change plan, which is gender neutral, the one that I've showed you over the past few slides, and we've adapted it into a woman-specific version, which is called My Change Plan Woman. So important to mention that this is, the content that we've added on is, does not replace the existing gender neutral content, but rather complements it. So we've added content that was co-developed by, we had 5 patient partners. Those are women who were seeking smoking cessation support at our clinic, who we've asked for their help. So we had 5 women who helped us develop this content. And we also used a large multidisciplinary team of researchers and clinicians to help us develop this content. So this is a snapshot of the activities we started, last summer. We had the My Change Plan app on the left-hand side. So what we did throughout the past year is, we engaged those 5 patient advisors. We consulted some scientific advisors, which helped us develop just some gender-informed content. And the last phase was to integrate the content of that we've developed into the My Change Plan, and therefore creating My Change Plan Woman, which is a woman-specific version. So I'm very excited to share with you some of the content that we've developed. So we've had interviews, women talk about their quit journeys, and also we've added some animation videos and testimonials. So these are the testimonials that we've had, women tell us a little bit about why they wanted to quit. They also told us what made it hard for them to quit. And, many women have barriers for quitting, but at the same time, they were able to strategize, overcome those barriers. So sharing, both the struggles, but what has helped them overcome it with a lot of messages of encouragement. We've also had, developed the content to go with that library that was specific for women. We also created 4 animation videos, and the first one, which we'll see very shortly, is a woman talking about her lifelong relationship with cigarettes. And as we listen to that video, I think you can pick up a lot of those women-specific, motives for smoking and also barriers for quitting. So you can hear it quite loudly in Mandy's monologue, which is going to come soon. We also talked about, smoking and stress. Does smoking really help me deal with stress? And, the short answer is that it doesn't. It helps momentarily distract, but it does not reduce levels of stress. So we wanted to provide a psychoeducation piece to women. We also have, a group of 3 women talk about their experiences, both the quit, struggles, but also quit strategies. And then last but not least, we had a video that, we show a woman who is taking her first step in their smoking cessation journey. And another important thing is that, for many women, they may not be ready to quit, but they are ready to make smaller changes into their smoking, for example, like reduction, like tracking. And here we showed, a woman who is facing those challenges, right? She's not ready to quit, but she is looking to make some steps in her quit smoking journey. So I think our next slide will be to share this video. So I think, Natalie, you're going to help me with this, right?
I started smoking in my last year of high school. I was 18 at the time. It seemed to me then as something the cool kids did. It helped me feel connected with some of the other friends who also smoked. I also knew that my parents disapproved of it, so it made me feel like I was rebelling against them, being modern as opposed to old-fashioned like my parents were, where women didn't smoke. Well, I got married rather young, and by the time I was 25, I was already a mother of 2. My husband and I were barely making ends meet at the time. He was working long hours, mostly outside the home, and I was juggling between my day job and caring for our 2 young children. Those years were very stressful. I turned to smoking to deal with the stress of day-to-day demands. When things were too much to handle, I could always distract myself by lighting up a cigarette. Those were the only few minutes in my busy day that I was by myself, relaxing, not having to think about kids, the house chore, my job. I guess ever since then, cigarettes are my go-to when it comes to dealing with stressful situations and taking time for myself. That's a good question. Yes, I think so. For example, when my children were little, my husband and I would argue a lot. At times, the arguments would get heated, which would make me feel lonely and scared. I remember I used cigarettes as an excuse to step out of a difficult conversation. Cigarettes helped me take control over the situation, made me feel safer, calmer. I think these patterns stayed with me till this day. I tend to smoke more when I'm feeling stressed, for example, at work and at home. Another thing that comes to mind is the exact opposite. Cigarettes are also a great tool to bring people together. In fact, one of my good friends, a colleague of mine, she and I are both administrative assistants at the office. We meet every day outside the office to unwind together from the job stress and have a coffee and cigarette right after lunch. We share this special bond over smoking. Many of the other workers disapprove of our smoking, but we have our cigarettes and we have each other. Well, I am aware that smoking is not good for you. I am 50 now, and so far, I've been pretty healthy, but I am starting to cough up in the mornings. When I went to see my doctor for the cough, she told me I should try quitting smoking. I find that quitting is hard. I wasn't successful in quitting even though I tried a few times. Besides, cigarettes and I go way back. I've been smoking since I was 18. Cigarettes were with me through the good times and bad. They've been something constant, something I can rely on. I even call it my best friend. It feels difficult to let them go. It's hard to imagine a life without cigarettes, since I've been a smoker for so long. If I look closely at my life, I see that smoking is built into my daily routine. Smoking in my work breaks with my good friend. Smoking cigarettes as a way to manage conflict and deal with stress. And smoking is something I do when I want to take time just for myself. I think it may take some time to make these changes, but I would like to try. My health is what matters most.
Okay, thanks very much for showing the video of Mandy. Okay, so now we get really to just a few final slides and talk about our research study. And in this study, we want to test the acceptability of the app that we've developed, the women-specific app. So one of the things that we want to know is, how women perceive this app. And women will have a trial period of 28 days to use this app. And then we ask them, using the app is likely to help me make changes to my smoking habits. And we want to know how women feel about this statement. For us, we would consider the app to be acceptable if the majority of women would tell us that they either agree or strongly agree with this statement. So we'll have this trial hasn't started, so that's really the main thing we were trying to determine in our study. Another thing about this is that we are giving this app for a trial period of 28 days, and we do want to see the engagement levels, and for us to consider that the app is feasible in helping women quit smoking, we would want to see that they've been using it for at least 7 out of those 28 days. And again, if the majority of women will use the app for at least 7 days, we will consider that it's feasible for women to use this app for smoking cessation support. Once women complete their 28-day trial period, we are going to conduct an interview in which we want to gain an in-depth look into their experiences. Specifically, what are some of the things they liked about the app? Were there, some things that they would like to see different, or, were not as successful in the app? We also asked them kind of an open-ended question, like what are some of the things in the app that you feel could be helpful for women? And later we conclude with just open-ended suggestions how to make this app even better. And about the testing of the app, we are going to recruit 30 women who smoke cigarettes daily, at least 5 cigarettes a day. These are women between the ages of 25 and 65 who have access to the internet and a smartphone. And one of the main things that we are hoping to find in our preliminary study is really, if the app is acceptable and feasible. And if we determine that the app is both acceptable and feasible, we would like to move it into the next step, which is giving women, some women the woman-specific version and some women the gender-neutral version, and seeing which one does a better job in helping women in their quit process. So it's going to be a head-to-head sort of a randomized control trial, but we're not there yet. In order to get there, we need to finish first our acceptability and feasibility study. So I just want to give a shout out to the research team that's working on this project. Many of them are you're familiar with, and work at our nicotine dependence clinic or Intrepid Lab, Dr. Selby, Zarateo, Minian, Veldhausen, and other colleagues, both from ChemAge and the U of T. A big shout out to our research coordinator, Rajni Panda, and our manager, Shelly Ahad. And also to our funder. This study has been funded through the ChemAge Woman Mind Foundation. And I think this is when we open up for discussions, for questions. And I do want to say that if you have, patients or women that smoke that may be interested in taking part in this study and testing the app for 28 days, feel free to send us notes and emails to this address, mychangeplan or mcp.women@chemage.ca. And we are planning to hopefully start recruiting very soon. We are just in the final stages of getting ethics approval at ChemAge. So hoping that this will start perhaps next month even. So we'll be really happy to get your referrals. Okay, so I think this is where we have some time left for questions.
Yeah, thank you very much, Dr. Melamed. It looks like we have one already in the chat from Elizabeth and Stacy. They wondered why animated videos as opposed to real people telling their stories.
Yeah, that's it's a really good question. I think that I do see some advantages to having, real people share their story. I think that one of the main reasons that we chose to do animation videos is to protect the anonymity of the women that were patient partners in this. So even though a lot of what they said comes into videos, you can't really connect it back to the women because they were using obviously avatars. It's they don't look the same, and we don't have any identifying information. But I think that just animation videos helps us sort of deliver greater content, and still protecting the anonymity of individuals. We may have a harder time sort of recruiting people for sort of this in-person video, but it's definitely I noticed some different programs have done have recorded real patients, and I think that there is a value. I see a value in sort of seeing a real person talk about their experiences. So I think it's a bit of a trade-off that we did here, but yeah, we chose to go ahead with the animation videos.
Totally makes sense. Another question for potential study recruits, do they have to be unfamiliar with the current MCP app?
That's a really good question. I think that we don't really have this as sort of as an exclusion criteria because the app is out and alive, and we do know that some people may have used it before. I think we are more interested in the new content, and we ask more questions about this content specifically. So I think, yeah, it's fine if a person has used the app, the gender neutral version before. They are going to be more, I think, directed toward focusing on the gender specific content and how they perceive it. Is it effective? Is it helpful? Do they want to see something else there? So I think, yeah, that shouldn't be a problem for recruitment.
Awesome. We do have about 5 more minutes left before we start to wrap up. So feel free to share any other questions in the chat. If not, is it okay if anyone reaches out to you, Dr. Melamed, with any outstanding questions or anything they come up with after?
Yeah, 100%. So yeah, here's I just moved a slide. So here's my email and the study referral email. So feel free to reach out to me, and happy to answer any questions.
Oh, there's another question. Is there a cost to the MCP app?
No, so the good thing is that the app, was developed, by students, clinicians, and patient partners at CAMH and U of T, and now it's maintained by CAMH. So currently, it's free for anyone to use. There's no cost to it. So and same, of course, for the um, the study that we're planning to do. Of course, women who participate as research participants do get compensated for some of the time that they have to fill in some questionnaires and surveys.
Sounds good. I don't know if you can see, there's a couple other questions in the chat. Mohammed asks how the MCP app can help women with hormonal disturbance and severe stress.
Yeah, so I think it's a really good question. So I think what the app does is provide more information to women around the link between smoking and stress. And also comes up with, provide some strategies from other women who have had this challenge. So women who have been or quitting smoking, who have quit smoking in the past, provide some strategies on, what can help. what can be helpful. And we actually show it in a different video. Specifically for your question about hormonal changes, so that because it's still under study, we don't have currently, or I would say we have some conflicting evidence whether timing of the quit attempt into the menstrual cycle helps women. Some studies told us that it does help, and other studies did not show that. So the study we're conducting now will give us a more definite answer about, whether it's important or useful or helpful to time the quit to the menstrual cycle. So right now, I think what we can say to women, or, if we kind of do a consultation with women, right, we can ask them if they feel any change in their withdrawal symptoms, when they, let's say, start to try to go without smoking, do they find it's harder for them later in the menstrual cycle phase, or is it easier for them, right, in earlier phases? And just according to what they tell us, we can, I guess, guide them, right? If it just makes sense that if it's harder for them, they feel that it's harder for them, around it, like just before the menstrual cycle begins, sort of like the PMS time, then we can instruct them maybe to try and quit earlier in the cycle. But if they tell us, really, I don't feel a difference, then, we don't really need to make a change. But, it is a point that we could discuss with our clients, with our patients.
For sure. There's just a couple other recruitment related questions. So someone's wondering if there's a poster that they can, Carol's wondering if there's a poster that they can share at their place of work to recruit women.
Yeah, thanks very much. So we do have a poster, but we are not allowed to post it yet because we are waiting for the final approval. We sort of had this interim check with ethics, which means that overall most of the things are looking good, but we did have to make some minor changes which are still under review. So once we have that approval, which I think will probably be coming by the end of this month, by the end of November, we will be able to share some materials with you, and I think probably it could go out through the Teach listserv to folks, so please keep an eye out for that.
Awesome. And Adina is wondering if they have to be from Ontario or can they be from Quebec or other provinces?
Yes, a really, really great question. I do apologize. I know that this, is a pan-Canadian network. I do apologize, but our participants will only be recruited from Ontario. It has to do with ethics approval. So unfortunately, we only women who have their mailing address in Ontario, residents of Ontario, will be able to participate. So I'm really sorry about that.
Sounds good. Okay, a couple more questions and then we'll wrap up. Can potential recruits see the video, learn about the app? They would be using the app, correct?
Exactly.
Yeah.
So once women are recruited into this study as study participants, they will meet with our research coordinator. They will download the app. We will see that it works, and then they can just take it off for 28 days and then come back and tell us what they thought of the app.
Wonderful. And Carol's just wondering if there's any studies about postmenopausal women that you're aware of.
So, our study includes women between the ages of 25 to 65. So we'll include postmenopausal women as well. Specifically for postmenopausal women, I'm not sure that we have a specific study, but we do have ongoing research studies. For example, coming soon is a study with a smoking cessation chatbot to help with varenicline adherence, and that will be open both for men and women of all ages. I think that they have like an end age of 70 years old. So I think that I think under the nicotine dependence clinic website, there are a couple of studies that might be recruiting, women in that age if folks want to have a look. Yeah.
Wonderful. Well, thank you so much, Dr. Melamed. I think we'll have to wrap up for now. But if you do have any final questions or thoughts, feel free to share with Dr. Melamed through her email there. If anyone needs to head out, please feel free to do so at this point. I'll just go through a few more housekeeping items for those that are interested. So I'll just take back control of the slides there. So yeah, just a reminder for those that are interested, a link to the evaluation and post-learning assessment will be emailed to you by tomorrow, and you'll have 1 week to complete that in order to receive a letter of completion. Along with that, anyone that registered will receive a copy of the slides and recording to share with anyone or review on your own. And a heads up that actually Dr. Lauren Greaves, who was a part of putting together this study that Dr. Melamed was sharing, is presenting next month on vaping, smoking in women on December 6th. So look out this week for the marketing for that and registration for that. So I believe that is everything. Just a final reminder that if you would like to rewatch a previous webinar or missed a portion of today's webinar, you can find an archive list on our website. But for now, thank you all so much for joining today, and thank you again, Dr. Melamed, for such a great presentation. We hope everyone has a great rest of their day. Thanks, everyone.
Thanks very much. Thanks for joining. Thank you, Natalie.
Thank you.